I think we're ready to go, everybody. So, good morning. I'm Candy Broad and I'm the Chair of the Board of Women's Health Victoria. It's wonderful to have you all here today for this very exciting event. Think again, why sex and gender still matter in women's health. I'm going to briefly hand over the microphone to Sheena Watt to acknowledge our traditional custodians. Sheena has recently joined the board at Women's Health Victoria and she is a proud Yorta Yorta woman. Sheena, come to the microphone.
Good morning all. Happy December, happy summer. I'm really actually delighted to be here this morning, and it's with a point of profound honour and respect that I come to you today to acknowledge the traditional owners of the land upon which we're meeting today. It's the people of the Kulin Nation, and I want to pay my respects to elders past, present and emerging. Of course, it's not customary or indeed practice of Women's Health Victoria to not have a welcome to country. So on behalf of the people of the Wurundjeri Council who were unable to join us this morning, they send their most profound apologies and have asked that I represent country today as I come up here today and talk to you about the connection between Aboriginal women, country, culture and health. Of course, I extend my respects to Aboriginal and Torres Strait Islander people who are here today. I recognise that sovereignty was never ceded on this land, that we, all of us, are the beneficiaries of stolen land and dispossession, which began over 200 years ago and continues today. Now, these are not my words. These are the words of Women's Health Victoria, words that I proudly have spoken many times on behalf of this very, very strong and proud organisation, and it brings me great pride to be a member of a board whose organisation stands firmly and says these words, and not just me as an Aboriginal person, all people involved, whether that's committee meetings, board meetings, or even large functions like this. It's incredibly important that Women's Health Victoria recognise and acknowledge their part in the ongoing privilege that they possess and the ongoing dispossession and trauma of Aboriginal people. Of course, today is a discussion about sex, gender and mental health. It's an important one, and for too long women's mental health has been neglected, and as the links between gender inequality are becoming more and more clear, they include discrimination, of course, poor mental health. We need to see equity in mental health outcomes between women, men and gender diverse people. But we also need equity among women. And this means recognising for some groups of women, they experience significantly poorer health and mental health outcomes than others. The mental health statistics for Aboriginal and Torres Strait Islander women are very alarming, and it scares me that I'm about to read out some of these statistics because the truth is they are just so very frightening. Suicide rates amongst adolescent Aboriginal and Torres Strait Islander women are nearly 6 times higher than non-Aboriginal young women. 6 times, it's just so profound. And Aboriginal and Torres Strait Islander women are hospitalised for self-harm at twice the rate of non-Aboriginal women. And the hospitalisation rates generally increase with the levels of disadvantage and the degrees of remoteness in our community. That's something we must continue to remember today as we gather and discuss these important topics. We know that poor mental health is often linked to experiences of violence and trauma, and they don't stop with the individual. These live on intergenerationally. And for Aboriginal and Torres Strait Islander women, poor mental health is linked not only to higher rates of family violence, but also to everyday experiences of racism and discrimination. And intergenerational trauma arises from many things, but we cannot forget colonisation, dispossession and government policies that have stolen women and children from their communities. and I am the beneficiary of those practices, with my mum being removed from her family at 6 weeks of age. But we must know that for all these horror statistics, Aboriginal women are strong, they are resilient, and they are proud. Their connection to country, kin and culture is a protective factor in their mental health, and that Aboriginal women play a critical role in supporting the mental health of not only themselves but of their communities. It's important to continue to bear the intersectionalities between gender, race and colonisation in mind throughout your discussions today. And may I also just say that the ongoing moves here in Victoria around treaty are about acknowledging our past and moving together as a community for better outcomes for all and a shared understanding of our history and story. So on behalf of Women's Health Victoria, I acknowledge the women of the Kulin Nation. I respect and honour them as our first Victorian women and continue to pay my most profound and dearest respects to them. Thank you.
Thank you, Sheena, and we're very proud to have you as a new member of the Women's Health Vic Board. I'd like to now proceed to acknowledge some of our special guests this morning. So we have with us the Hon Gabrielle Williams, Minister for Prevention of Family Violence, Minister for Women and Minister for Youth in the Victorian Government. Diane Hill, Chief Executive Officer, Women's Health Vic. Professor Jayashri Kulkarni, Professor of Psychiatry, Monash University Alfred Health. Professor Jane Fisher, Professor of Global Health, Monash University. Marilyn Beaumont, Chair of the Women's Health Network, and recently inducted into our Champions for Women's Health at the Women's Health Vic AGM. And Dilnaz Bilmoria, Board Director, Women's Health East. For those of you who don't know us, Women's Health Victoria is an independent statewide women's health promotion, advocacy and support service. This year we are celebrating our 25th anniversary. Our vision is women living well, healthy, empowered and equal. The work we do is informed by a feminist approach to health promotion and the social determinants of health. That means that gender equity underpins everything that we do. Mental health and body image have long been standing priorities for Women's Health Vic. We have a strong focus on addressing the social determinants of mental health, including discrimination, violence and gender inequality more broadly. Addressing body image and the sexualisation of women is an important focus. Some of you may be familiar with our famous Labia Library and with our project addressing sexism in advertising, which you'll hear more about if you attend the body image breakout session later today. So we find ourselves at a critical juncture for women's health and women's equality. Last week, we saw an Australian first in legislation for gender equality introduced into the Victorian Parliament, and I'd like to take this opportunity to publicly congratulate the Minister for her achievement in what is always a very full-on last week of the parliamentary session, and it means that it's right up there when the Parliament resumes in 2020. And also congratulate the Victorian Government as a whole on this landmark reform, which recognises the discrimination and disadvantage women still face, both in the workplace and in accessing the services that they need. It's encouraging to see public sector agencies leading the way in challenging entrenched gender inequalities. Last week also heralded the release of the interim report of the Royal Commission into Victoria's mental health system. So it was a big week. We're pleased to see that the Royal Commission has recognised the impact of discrimination and family violence and broader gender inequalities on women's mental health. While we expect that many of the proposed reforms and increases in investment will have a positive impact on women and girls, the interim report does not propose reforms that address their specific needs and experiences. So, the next phase of the Royal Commission's work gives us all an opportunity to make sure that the mental health of women and girls is squarely on their agenda. So to that end, Women's Health Vic is very pleased to be a founding member of the new Women's Mental Health Alliance, announced last week, and to be here with you today hosting this symposium, which will focus on gender, mental health and substance use. On today's program, we are very fortunate to have with us two international experts in gender equity and gender transformative practice, Drs Lorraine Greaves and Nancy Poole from the Centre of Excellence for Women's Health in British Columbia, Canada. They've come a very long way to be with us today, and thank you so much for that. Women's Health Vic has a long history of collaboration with Lorraine and Nancy, including contributing to their 2014 book, Making It Better, Gender Transformative Health Promotion. Our MC, Ruth, will give them a proper introduction, that is a more detailed introduction, but it's true to say that Lorraine and Nancy's work has been hugely influential on Women's Health Vic's thinking and practice. So when they contacted the team at Women's Health Vic to tell them that they were coming to Melbourne, we jumped at the chance to hold an event where their insights could be shared with a wider audience. And in the context of the current work happening in Victoria on gender equity and mental health, Lorraine and Nancy's experience working in the fields of mental health, substance use and trauma-informed practice is very timely indeed. I'd also like to say that we wouldn't be holding this event today if it weren't for the support of the Victorian Government and VicHealth. And I'd like to extend further thanks to Minister Williams and the Office of Women and to VicHealth for their generous support for today's event. What is now left to me to do is to hand over to our fabulous MC for the day, Ruth D'Souza. And I've got a little bit to say here about Ruth, I do. Ruth is an experienced nurse, academic, speaker and facilitator with expertise in cultural safety, maternity, migration, social inclusion and mental health. With a passion for culture and health, Ruth's theoretical interests include feminist theory, post-colonial theory and critical qualitative research methodologies, exploring health inequities, improving healthcare outcomes for marginalised and underserviced groups. Ruth's work experience spans maternal mental health, research into women's experiences of birth in another country, refugee women's experiences of resettlement, and barriers and enablers to cervical screening in migrant women. Ruth is currently the academic convener of the Data, Systems and Society Research Network and Honorary Senior Research Fellow at the Health and Biomedical Informatics Centre at the University of Melbourne. Over to you, Ruth.
Hi everyone, you're looking good on a Monday morning. What an honour it is to be here, and I want to start by just acknowledging that beautiful acknowledgement of country from Sheena, and acknowledge my own position as someone who's an uninvited guest on Kulin country. I'm going to tell you a little bit more about myself, not that there's that much more to tell after that wonderful introduction. But what I'm going to do is start by introducing our next speaker, and then after that I'm going to tell you a little bit about what the day's going to look like and what kind of fun we're going to have and what kind of great conversations. Does that sound all right? Yeah, good. That was just a test to see if everyone's listening. I was like, okay, so Gabrielle Williams is the Minister for Prevention of Family Violence, Minister for Women and Minister for Youth in the Victorian Government. That is a very big portfolio, I have to say. She was appointed to the Cabinet in 2018, having previously served as a parliamentary secretary, and proudly represents her local community as the member for Dandenong. Woo! Anyone from Dandenong here? Where was the woo? Where was the woo? Am I the only woo? Come on, yeah, thank you. Gabrielle holds a Bachelor of Laws and a Bachelor of Arts with honours from Monash University. She has previously worked as a lawyer and project manager. These are very good skills, and has served as the director of a not-for-profit disability sport organisation. Gabrielle is a passionate advocate for equity and social inclusion, and is proud to be a member of Victoria's first ever gender equal cabinet. That's a woo, everybody? Woo? Yeah. I'm trying here, you know. Monday morning, people. She's committed to driving an important reform agenda to improve outcomes for women, young people and families across Victoria. Can we give her a massive hand?
Thank you, Ruth. Hopefully I might be able to get a few woos along the way as well. Although with those shoes, I think you've got a far better chance of getting them than I do. I'm feeling very conservatively dressed, but you look wonderful. Look, thank you all for having me here with you today. Before I begin, please let me acknowledge the traditional owners of the land on which we meet and pay my respects to their elders, past, present and emerging, with special thanks to Sheena Watt for that wonderful acknowledgement to country. And also reflecting on the fact that I try not to say those words out of habit, but instead to reflect on why it is that we acknowledge our traditional owners, and to reflect on the fact that as a non-Indigenous Australian, I am so exceptionally proud of our Indigenous history. It is so unique. It is part of what makes us an incredible and critical part of what makes us so special here. And whether you are Indigenous or not Indigenous, whether you were born here or whether you chose Australia as your home, we should all be exceptionally proud of that history and of the generosity of our Aboriginal population in sharing that with us, especially in light of the enormous trauma that they've suffered as a consequence of colonisation. I also want to acknowledge just some of the special guests here we have today. Obviously, Candy Broad, Chair of Women's Health Victoria, somebody who has given an enormous amount of time and effort and passion in her life, both in an elected capacity in the Victorian Parliament as well, but also in the numerous roles that she's fulfilled since, with a particular emphasis on improving outcomes for women. It's always somewhat interesting for me to acknowledge Candy, because I started off my political life working as a staffer in the Brax-Brumby years, where Candy was one of these women you used to sort of look at in awe and just be and admiration of. So now to sort of get to be sort of chummy with her is sort of, part of me is still sort of fangirling, you know. I'm just pretending, Candy. Thank you. Of course, to Diane Hill, CEO of Women's Health Victoria, such a wonderful organisation, 25 years, almost as old as me. And of course to our international guests who have unfortunately brought the weather with you from Canada, but it is a pleasure for us to have you, Dr. Lorraine Greaves and Dr. Nancy Poole. We are so fortunate to be able to share in that expertise and to have the value of your work given the world-leading nature of it. So thank you for being here with us today. And as I said, there are many, many others in this room. In fact, it's kind of the who's who of women's health. There are so many experts and change makers in this room, which I think is testament to the discussion that's going to happen here today, and also just a testament to the commitment, passion and just wonderful expertise that resides here in Victoria and Australia, and the networks that we have internationally. So thank you very much for that. It's always lovely to stand at a lectern and look out onto a sea of largely women. No offence to our sort of one or two men in the room, but it is always, fills my heart with joy. Look, it's always a pleasure to attend events like this where the discussions are so pertinent and important. Many of you will work in areas connected to women's health on a day-to-day basis, and I think will be more than acutely aware that gender and sex still matter in service delivery. But equally, as legislators and as policymakers, sex and gender is absolutely a key consideration in government decision-making, and increasingly so. For our government, gender equality has been at the heart of our policy policy agenda, particularly since the Royal Commission into Family Violence, which, among many other things, told us that gender inequality was a key driver of violence against women and family violence. And I think that really did start to mainstream a discussion within government, and I think also increasingly within the community, about the importance of gender equality, not just as an academic concept, but because of the real world outcomes it delivers. And that's been a joy to be a part of that conversation, to be working and partnering with so many sectors to make sure that we are achieving meaningful change. And I think today's discussion is another aspect of that, and I will touch on that. We know that, that one of the leading contributors to poor health and wellbeing is gender inequality, and as a government we know that to improve the health and wellbeing of women and girls across our community that we need to address gender inequality. But we can't achieve gender equality unless women have access to appropriate health care. We know that. And women obviously won't have access to appropriate health care unless we have a really strong health workforce that has a very clear understanding of how sex and gender can affect healthcare outcomes. And I also wanted to add to that so much of this discussion that I also think is really important is not just about what happens within healthcare settings and the importance of obviously keeping people happy and well, but the ramifications that then has to women's participation in life. And their participation in the workforce, for example. And so much about these discussions also goes to destigmatising women's health concerns, which, you know, I see in different corners of my work all the time has a very significant impact to women's participation. And in introducing the Gender Equality Bill into Parliament last week, it's often something that comes up about women in the workforce and how essentially many don't feel that they can raise some of the challenges that they confront because of the stigma that's attached to them, stigma that should not attach to health concerns that are, well, probably going to be experienced by most of us, if not all of us, at some point in time, depending on what it is. So these sorts of discussions are really important and should be seen in that broader community and participation frame as well. In recent years, we've been learning more and more about how men and women experience adverse health differently, and I'm sure you're all aware of the campaign that the Heart Foundation and others, I should say, have been running to raise awareness about different symptoms between men and women experiencing, for example, stroke. You know, we know that the typical stroke symptoms that we were sort of led to understand were focused particularly on the male experience, and we now know that women experience different typical symptoms that need to be accounted for in diagnosis and treatment. Migraines are another good example, and I'm sure you're all aware that historically migraines were often dismissed or incorrectly diagnosed. Women are 3 times more likely to suffer from migraines, and gender biases have absolutely undoubtedly been a part of the reason why migraines traditionally didn't receive the same attention as other health problems. And that's before I even get into clinical trials and dosages and all those other things that we know have been skewed against women from the start, often with quite dangerous consequences. Finding the ways that sex and gender affects women's health and tailoring suitable services to account for these differences is the only way issues like this will be properly identified and addressed, and also the only way that we'll start to see a destigmatisation too of certain conditions for women and an increase in participation that comes with that. Even as experts in women's health and public policy, it is not possible to see every inequality on the face of it, and I think that's why we need tools to help us actually go proactively looking for them. And a good example of this and how governments can also play a role in this is one that on its face, when I came across it, doesn't appear to relate overly to health at all, but it was the example that relates to snow ploughing in Sweden. Some of you hopefully have heard this one, but I really enjoyed it. So in 2012, as a part of a commitment to gender-based budgeting, the Swedish city of, and I'm going to pronounce it incorrectly, my Swedish is a little bit thin, Karlskoga. Anyway, they analysed everything in their budget, including the city's snow ploughing program. Now, the traditional practice was to plough the biggest roads first, as it was seen to essentially help the greatest number of commuters. But however, the gender budget analysis found that men are more likely to take direct routes to and from work during peak hours. However, women were more likely to take indirect routes to and from work throughout the day, also adding trips to drop off or pick up kids and run various sort of household errands. So this meant that men tended to disproportionately use major roads and women tended to disproportionately use those smaller roads. And this also, though, meant that women were disproportionately turning up to hospital with injuries from having slipped and fallen on icy roads. So as a result of the analysis, all Swedish cities have now moved towards clearing snow from pedestrian paths and smaller roads first. And analysis shows that it has resulted in fewer hospital admissions and has been more productive for the economy. Go figure. And I think it's a really great, somewhat quirky example, though, of why we need to use gender analysis tools and frameworks to find those hidden inequalities across our cities and societies. And it really does highlight where the gains can be achieved too if you get those settings right. And the Andrews government has been trialling the use of gender analysis tools to improve policy and budgeting decisions, and this is one of many measures that we've been employing in order to more proactively address gender inequality. As Candy outlined at the beginning last week, we introduced into the Parliament a gender equality bill that will require Victorian public sector organisations, including state departments, local councils, universities, many others, to measure and report on gender equality in their organisations, but to also create action plans to address that inequality so that we can see a continuous improvement in those organisations. There will be a strong focus on gender equality within the workforces of those organisations, but they'll also be required to consider the gender impacts of their policies, of their budgeting and of their services. Those affected organisations, those that are captured by this bill, represent about 11% of the Victorian workforce, because obviously government is a very key and large employer in any state, in any country. And through that, the work of these organisations, even beyond its own workforce, impacts a significant proportion of Victorians, which is why this bill is so very important. The bill will make gender analysis tools part of business as usual for decision-making processes throughout Victorian public sector workplaces and communities. So what you're discussing and learning here today are skills that will be required in all jobs into the future. So I think that's also really important to note. But apart from that, we know that there's skills that will make you better healthcare providers and improve our services no end. So once again, I'm really pleased to be with you here this morning to open the event. It's going to be very thought-provoking, exciting, and I'm sure that you'll learn lots of practical tools as well that you'll be able to take into your day-to-day work. Thank you, though, also for the work that each and every one of you does in various capacities that ultimately does achieve better outcomes, particularly for women and girls across our community. And to finish on a note that I often find myself discussing, particularly among those who are quite cynical about gender equality. They still exist, sadly. Some of them are even elected. But it's the fact that gender equality benefits everybody. We're all diminished by inequality. So this notion that by improving equality, we are somehow taking something away from people is a nonsense. I've had cause to say in recent times to many men, well, a couple of things. One, when they worry about, some more frank than others, you might imagine. But one was around, we had a bit of a giggle. I'm going to tell you a quick story. In the coverage on the media about the gender equality bill, there was a certain right-wing radio shock jock who was took up a significant amount of airtime talking about this, which was a KPI tick for me. Great to see him talking about gender equality. But one of the callers that called in said, all men must defend the 50% line. And I thought, great, that means you've retreated. That's brilliant, right? Finally. But it's also a very significant part of this narrative needs to be the fact that, we're also making the pie bigger in this process. It's not just about increasing our share of the pie, it's about making the pie bigger. The economic benefits, the social benefits of equality are profound. They're increasingly becoming better known. This is for the sake of the whole community, and I think that's a really important part of our narrative going into this. So thank you very much for doing your bit. Thank you very much for these discussions, which are absolutely critical to us improving outcomes for women and girls across our community. And thank you very much for all the work that you have done, are doing, and will continue to do over time. Thanks very much.
Thank you so much, Gabrielle, for that fantastic talk. What I was really struck by in your talk, Gabrielle, was just the importance of looking in new ways, because privilege is invisible. So until a new tool and a new way of looking was applied, it's very, very hard to see when things are unfair. Yeah, and what I really appreciated about what you said is your commitment to kind of building a world where everyone can flourish, and I think that's really what we're all here for today. Okay, I'm going to ask you now to just take a minute to introduce yourself to someone at your table that you don't know, or if you know everyone at your table, someone else, and just why you're here and what you're hoping to get from the day, and then I'll talk about the really important housekeeping stuff.